Are you preparing for the Nclex and struggling to remember all those tricky pharmacology questions? Don't worry, today, I'm giving you 50 high-yield Nclex pharmacology questions with clear rationales and simple strategies that will help you crack the exam like a pro. These aren't just random questions, these are the must-know medications, side effects, and test tricks that repeat year after year on the Nclex. So stay with me till the very end, because each question comes with a shortcut to help you spot the correct answer instantly on test day. Let's dive right in. Question 1. A client taking warfarin, Coumadin, needs which laboratory value monitored for effectiveness? A. APTT. B. INR. C. Hemoglobin. D. Platelet count. Correct answer, B. INR. Rationale. Warfarin works by inhibiting vitamin K clotting factors. The best test for effectiveness is the International Normalized Ratio, INR. Therapeutic INR equals 2 to 3, 2.5 to 3.5 for mechanical valves. APTT is for heparin, not warfarin. Hemoglobin and platelets show anemia or bleeding risk, but not warfarin's effectiveness. Strategy. A classic Nclex trick is to confuse INR with APTT. Remember. Warfarin IN for INR. Heparin PTT. If the question asks about warfarin monitoring, choose INR. Question 2. When does regular insulin peak? A. 30 minutes 1 hour. B. 1 to 5 hours. C. 6 to 14 hours. D. No peak. Correct answer, B. 1 to 5 hours. Rationale. Regular insulin onset equals 30 to 60 minutes, peak equals 1 to 5 hours, duration equals 6 to 10 hours. Rapid-acting insulin, Lispro/Aspart, peaks at 30 to 90 minutes. Intermediate-acting, NPH, peaks at 6 to 14 hours. Long-acting, Glargine, has no significant peak. Strategy. Peak equals highest risk for hypoglycemia. Think, regular insulin equals 1 to 5. On Nclex, if asked, when should a patient eat to prevent hypoglycemia? Always answer at the peak time. Question 3. A client taking an ACE inhibitor, lisinopril, develops a dry cough. What is the best action by the nurse? A. Reassure and continue the drug. B. Stop the medication immediately. C. Call the provider for possible change. D. Give an antihistamine. Correct answer, C. Call the provider for possible change. Rationale. ACE inhibitors cause bradykinin buildup dry persistent cough. This is not dangerous but uncomfortable, so the drug is usually changed to an ARB, losartan. Nurses cannot stop medications, B. Antihistamines, D, won't help because it's not an allergy. Strategy. ACE equals a cough expected. If Nclex shows ACE plus dry cough, the safe answer equals notify provider for alternative therapy, ARB. Question 4. Which side effect of gentamicin, aminoglycoside antibiotic, is the most concerning? A. Nausea. B. Headache. C. Ringing in the ears. D. Fever. Correct answer, C. Ringing in the ears. Rationale. Gentamicin and other aminoglycosides cause ototoxicity, hearing loss, tinnitus, dizziness, and nephrotoxicity, kidney damage. Nausea and headache are mild. Fever may mean infection, not drug toxicity. Strategy. Memory trick. Aminoglycosides NO ears, NO kidneys. If Nclex gives tinnitus or elevated creatinine, think aminoglycoside toxicity, stop the drug and notify provider. Question 5. What is the best teaching for a client taking levothyroxine, Synthroid? A. Take with food for best absorption. B. Take only when symptoms return. C. Take in the morning on an empty stomach. D. Stop once symptoms improve. Correct answer, C. Take in the morning on an empty stomach. Rationale. Levothyroxine works best when taken on an empty stomach, 30 to 60 minutes before breakfast. It is a lifelong therapy. Stopping leads to hypothyroidism symptoms returning. Food decreases absorption. Do not skip doses. Strategy. Levo equals leave food behind. On Nclex, always choose, take daily, in the morning, on an empty stomach. Question 6. What is the most dangerous side effect of morphine, opioid analgesic? A. Constipation. B. Drowsiness. C. Respiratory rate of 8 per minute. D. Nausea. Correct answer, C. Respiratory rate of 8 per minute. Rationale. Opioids depress the central nervous system. Respiratory depression is life-threatening. Constipation, drowsiness, and nausea are common but manageable. A respiratory rate less than 12 is dangerous. Strategy. Morphine equals monitor breathing. On Nclex, if RR is less than 12, hold the dose and prepare to give naloxone, antidote. Question 7. Which statement by a client shows poor understanding of digoxin, Lanoxin? A. I will check my pulse before taking it. B. I may see halos around lights. C. If I feel nauseated, I will keep taking it. D. I will report weight gain. Correct answer, C. Rationale. Nausea, vomiting, halos, and blurred vision equals digoxin toxicity. Must report immediately, not continue taking. Checking pulse is correct, hold if less than 60. Weight gain may indicate worsening heart failure, so reporting is correct. Strategy. Digoxin dig for pulse plus dig for toxicity signs, N/V, halos, vision changes. On Nclex, never ignore nausea or visual changes with digoxin. Question 8. Which electrolyte imbalance is most associated with furosemide, Lasix? A. Hyperkalemia. B. Hypokalemia. C. Hypercalcemia. D. Hyponatremia. Correct answer, B. Hypokalemia. Rationale. Loop diuretics cause potassium loss, hypokalemia, muscle weakness, arrhythmias. Hyperkalemia happens with potassium-sparing diuretics. Calcium is not affected significantly. Sodium may drop, but potassium loss is most dangerous. Strategy. Lasix equals lose potassium. Nclex loves to test this, check potassium levels before giving. Question 9. Which teaching is correct for nitroglycerin sublingual tablets? A. Swallow the tablet with water. B. Keep in a dark glass container. C. Take with meals. D. Wait 1 hour between doses. Correct answer, B. Rationale. Nitroglycerin is heat and light sensitive, must be kept in a dark glass bottle. Do not swallow, it must dissolve under the tongue. Meals are not required. Can repeat every 5 minutes times 3 doses, not 1 hour apart. Strategy. Nitro equals dark bottle, don't swallow, dissolve under tongue. Nclex may ask storage and administration questions often. Question 10. Which client is at greatest risk when receiving heparin therapy? A. A client who just had a vaccine. B. A client with platelets of 45,000. C. A client with mild hypertension. D. A client with migraine headaches. Correct answer, B. A client with platelets of 45,000. Rationale. Heparin may cause heparin-induced thrombocytopenia, HIT. If platelets are less than 150,000, dangerous. Vaccines, mild hypertension, or migraines are not contraindications. Strategy. Heparin HIT equals low platelets. On Nclex, always check platelet count before giving heparin. Question 11. Which laboratory value should be monitored closely for a client receiving vancomycin? A. Sodium. B. Creatinine. C. Calcium. D. Hemoglobin. Correct answer, B. Creatinine. Rationale. Vancomycin is nephrotoxic and may cause kidney damage. Creatinine is the best measure of kidney function. Sodium and calcium are not directly affected. Hemoglobin shows anemia but is unrelated to vancomycin toxicity. Strategy. Vanco equals very toxic to kidneys and ears. If Nclex mentions vancomycin, always think check kidney function, creatinine, BUN, and ototoxicity, hearing loss, tinnitus. Question 12. A client receiving prednisone, corticosteroid, is at increased risk for A. Low blood sugar, B. Infection, C. Weight loss, D. Hypotension. Correct answer, B. Infection. Rationale. Corticosteroids suppress the immune system risk of infection. They increase blood sugar, not lower it. They cause weight gain, fluid retention, not weight loss. They cause hypertension, not hypotension. Strategy. Steroids equals sugar up, swelling up, susceptible to infection. On Nclex, steroids equals infection risk plus masking of infection signs. Question 13. Which finding requires immediate action in a client taking phenytoin, Dilantin? A. Drowsiness, B. Overgrowth of gums, C. Rash on the body, D. Mild dizziness. Correct answer, C. Rash on the body. Rationale. Rash with phenytoin may indicate Stevens-Johnson syndrome, a medical emergency. Drowsiness and dizziness are common side effects. Gum overgrowth, gingival hyperplasia, is expected but not life-threatening. Strategy. Phenytoin equals phenytoxicity if rash. On Nclex, rashes, fever, or sore throat equals stop the drug and notify provider. Question 14. A client is taking lithium for bipolar disorder. Which laboratory finding is most concerning? A. Sodium 128 milliequivalent/L. B. Sodium 138 milliequivalent/L. C. Potassium 4.0 milliequivalent/L. D. Calcium 9.5 milligrams per deciliter. Correct answer, A. Sodium 128 milliequivalent/L. Rationale. Normal sodium equals 135 to 145 milliequivalent/L. Low sodium increases risk of lithium toxicity, even at normal serum lithium levels. Potassium and calcium values are normal. Strategy. Low sodium equals lithium toxic. On Nclex, always check sodium if the client is on lithium. Question 15. Which client is most at risk for theophylline toxicity? A. A client who smokes cigarettes. B. A client who drinks coffee every morning. C. A client who takes warfarin. D. A client who eats bananas daily. Correct answer, B. A client who drinks coffee every morning. Rationale. Theophylline is a bronchodilator with a narrow therapeutic range, 10 to 20 mcg/ml. Caffeine increases risk of toxicity, arrhythmias, seizures. Warfarin and bananas do not interact directly. Smoking actually increases theophylline metabolism, lowering levels. Strategy. Theo plus caffeine equals too much stimulation. On Nclex, always avoid caffeine with theophylline. Question 16. Which symptom suggests metformin, glucophage, toxicity? A. Blurred vision. B. Metallic taste. C. Severe muscle pain and fatigue. D. Constipation. Correct answer, C. Severe muscle pain and fatigue. Rationale. Metformin can cause lactic acidosis, muscle pain, fatigue, rapid breathing. Metallic taste is common but not dangerous. Constipation is unrelated. Blurred vision is more with hypoglycemia, not metformin. Strategy. Metformin equals monitor for lactic acidosis, muscle pain plus weakness. On Nclex, any muscle pain plus tiredness plus fast breathing equals stop metformin. Question 17. Which client should not receive the live influenza vaccine, nasal spray? A. A healthy 10-year-old. B. A 25-year-old with no allergies. C. A 2-year-old with asthma. D. A 45-year-old nurse. Correct answer, C. A 2-year-old with asthma. Rationale. Live influenza vaccine is contraindicated in immunocompromised, pregnant, and chronic lung disease, asthma, COPD. Healthy children and adults can receive it. Strategy. Live vaccines equals no for weak immune systems. On Nclex, always check for asthma, pregnancy, HIV, chemotherapy, infants less than 2 years. Question 18. A client is prescribed albuterol inhaler. Which instruction is most important? A. Take it at the same time every day. B. Use it before exercise to prevent asthma attacks. C. Rinse the mouth after each use. D. Take it with food. Correct answer, B. Use it before exercise to prevent asthma attacks. Rationale. Albuterol is a short-acting beta agonist used for rescue and prevention of exercise-induced asthma. It is not scheduled daily like steroids. Rinsing the mouth is for steroids, fluticasone, budesonide, not albuterol. Food is not relevant. Strategy. Albuterol equals rescue equals rapid. On Nclex, if the drug is albuterol, answer usually relates to acute attack or prevention before exercise. Question 19. A nurse is giving enoxaparin, Lovenox. What is the correct administration site? A. Deltoid muscle. B. Vastus lateralis. C. Subcutaneous abdomen. D. Intravenous line. Correct answer, C. Subcutaneous abdomen. Rationale. Enoxaparin is a low molecular weight heparin given subcutaneously in the abdomen. Not given IM or 4. Rotating abdominal sites is recommended. Strategy. Lovenox equals love handles, abdomen. On Nclex, if you see Lovenox, think subcutaneous abdomen only. Question 20. Which client is most at risk when taking clopidogrel, Plavix? A. A client scheduled for dental extraction tomorrow. B. A client with hypertension. C. A client with diabetes. D. A client with asthma. Question 31. Which finding is most concerning for a client on chemotherapy? A. Hair loss. B. Nausea. C. White blood cell count 1000. D. Fatigue. Correct answer, C. White blood cell count 1000. Rationale. Normal WBC equals 4000 to 11,000. WBC less than 2000 equals severe neutropenia, high infection risk. Hair loss, nausea, and fatigue are expected. Strategy. Chemo equals check WBCs. On Nclex, infection risk hair loss. Question 32. Which side effect of statins, e.g., atorvastatin, should be reported immediately? A. Muscle pain. B. Headache. C. Constipation. D. Dizziness. Correct answer, A. Muscle pain. Rationale. Statins can cause rhabdomyolysis, muscle breakdown, kidney damage. Headache and constipation are common but not dangerous. Strategy. Statin equals stop if sore muscles. On Nclex, muscle pain equals report immediately. Question 33. Which teaching is essential for a client taking insulin glargine, Lantus? A. Mix it with regular insulin in the same syringe. B. Take it once daily, same time every day. Question 36. Which drug requires the nurse to monitor potassium levels closely? A. Furosemide. B. Hydrochlorothiazide. C. Spironolactone. D. All of the above. Correct answer, D. All of the above. Rationale. Furosemide and thiazide's potassium loss, hypokalemia. Spironolactone potassium retention, hyperkalemia. All affect potassium but in opposite ways. Strategy. Diuretics equals disturb potassium. On Nclex, always check potassium with diuretics. Question 37. Which symptom is expected after starting SSRIs, e.g., fluoxetine, sertraline? A. Immediate mood improvement. B. Nausea and insomnia. C. Low blood sugar. D. Severe hypertension. Correct answer, B. Nausea and insomnia. Rationale. SSRIs take 2 to 4 weeks to improve mood. Early side effects equals nausea, insomnia. No hypoglycemia or hypertension. Strategy. SSRIs equals slow, side effects first. On Nclex, improvement equals weeks later, not immediately. Question 38. Which client is at highest risk for tetracycline complications? A. A 10-year-old child with acne. B. A 35-year-old with pneumonia. C. A 45-year-old with hypertension. D. A 60-year-old with diabetes. Correct answer, A 10-year-old child with acne. Rationale. Tetracycline stain developing teeth contraindicated in children under 8. Adults are safe. Strategy. Tetracycline equals teeth trouble. On Nclex, no tetracycline for pregnant women or children less than 8 years. Question 39. Which teaching is important for a client prescribed alendronate, Fosamax? A. Take with orange juice before breakfast. B. Take with full glass of water and remain upright for 30 minutes. C. Take immediately before lying down. D. Take only when having bone pain. Correct answer, B. Take with full glass of water and remain upright for 30 minutes. Rationale. Alendronate equals osteoporosis drug risk of esophageal irritation. Must sit/stand upright after taking. Not taken with juice or food. Strategy. Fosamax equals full water, floor upright. On Nclex, upright 30 minutes equals key safety measure. Question 40. Which lab result is concerning for a client taking methotrexate? A. Hemoglobin 15G/DL. B. WBC 2500. C. Platelets 200,000. D. Potassium 4.2 milliequivalent/L. Correct answer, B. WBC 2500. Rationale. Methotrexate suppresses bone marrow low WBC, neutropenia. Normal WBC equals 4,000 to 11,000. Other values are normal. Strategy. Methotrexate equals myelosuppression. On Nclex, low WBC equals infection risk. Question 41. A client is prescribed atorvastatin, Lipitor. Which finding requires the nurse to notify the provider immediately? A. Headache. B. Leg cramps and muscle pain. C. Constipation. D. Mild abdominal bloating. Correct answer, B. Leg cramps and muscle pain. Rationale. Statins can cause rhabdomyolysis, muscle breakdown, which is life-threatening. Headache, constipation, and bloating are common but not dangerous. Severe muscle pain equals red flag for statin toxicity. Strategy. Statins hurt the muscles. If Nclex shows muscle pain plus statin, always report it. Question 42. Which client should avoid taking aspirin, ASA? A. A client with osteoarthritis. B. A client with a history of gastric ulcers. C. A client with chronic headaches. D. A client with rheumatoid arthritis. Correct answer, B. A client with a history of gastric ulcers. Rationale. Aspirin increases the risk of GI bleeding and ulcers. Clients with a history of ulcers are at highest risk. It can be used for arthritis or headaches if no GI risk. Strategy. Aspirin equals acid eats the stomach. On Nclex, if the client has ulcers, GI bleeding, or children, Reye's syndrome, avoid aspirin. Question 43. A client taking warfarin has an INR of 5.2. What is the nurse's best action? A. Give the next dose as scheduled. B. Hold the dose and notify the provider. C. Give an extra dose for clot prevention. D. Document and recheck INR tomorrow. Correct answer, B. Hold the dose and notify the provider. Rationale. Normal INR for warfarin therapy equals 2 to 3. An INR of 5.2 equals too high equals bleeding risk. Never give another dose if INR is above range. Strategy. Warfarin equals watch INR, 2 to 3 safe. On Nclex, too high INR equals hold and report, too low equals risk of clot. Question 44. Which teaching is most important for a client taking cyclobenzaprine, Flexeril? A. Avoid alcohol while taking this drug. B. Take with milk to prevent ulcers. C. Use sunscreen to avoid sunburn. D. Report ringing in the ears immediately. Correct answer, A. Avoid alcohol while taking this drug. Rationale. Cyclobenzaprine is a muscle relaxant that causes sedation. Alcohol worsens drowsiness and increases accident risk. Ulcers, photosensitivity, and tinnitus are not related. Strategy. Flexeril equals flexible plus sleepy. On Nclex, think about safety teaching, no alcohol, no driving, no heavy machinery. Question 45. A client on ACE inhibitors, lisinopril, reports a persistent cough. What should the nurse do? A. Reassure the client this is expected. B. Instruct the client to stop the drug immediately. C. Notify the provider for a possible medication change. D. Encourage increased fluid intake to relieve symptoms. Correct answer, C. Notify the provider for a possible medication change. Rationale. ACE inhibitors commonly cause a dry cough due to bradykinin buildup. The drug is not life-threatening, but it may need to be changed to an ARB, losartan. Stopping suddenly may cause rebound hypertension. Strategy. ACE equals a cough expected. If cough affects quality of life, Nclex answer is usually notify provider for change. Question 46. A nurse is teaching about digoxin. Which statement by the client shows understanding? A. If my pulse is 50, I will still take the medicine. B. I should eat foods high in potassium. C. Blurred vision is a normal effect of the drug. D. I can stop taking this drug once I feel better. Correct answer, B. I should eat foods high in potassium. Rationale. Digoxin toxicity is increased with low potassium. The client should monitor heart rate, hold of less than 60 bpm. Blurred vision, yellow halos, equals toxicity, not normal. It should never be stopped abruptly. Strategy. Dig equals dig carefully, check pulse, check K+, check eyes. On Nclex, think about pulse, potassium, toxicity signs. Question 47. Which food should a client taking MAOIs, phenelzyne, tranylcypromine avoid? A. Bananas. B. Oranges. C. Apples. D. Grapes. Correct answer, A. Bananas. Rationale. MAOIs plus foods with tyramine, bananas, aged cheese, wine, cured meats, hypertensive crisis. Oranges, apples, and grapes are safe. Strategy. MAOI equals no bananas, beer, bologna, cheese. On Nclex, if tyramine food plus MAOI answer is always hypertensive crisis. Question 48. A nurse is administering nitroglycerin for chest pain. Which instruction is correct? A. You may take up to 3 tablets 5 minutes apart. B. Swallow the tablet whole for best effect. C. You can take as many tablets as needed until the pain stops. D. Take 1 tablet daily to prevent headaches. Correct answer, A. You may take up to 3 tablets 5 minutes apart. Rationale. Standard rule, 1 tablet every 5 minutes, up to 3 doses. If pain persists, call emergency services. Nitroglycerin is sublingual, not swallowed. It is not used daily to prevent headaches. Strategy. Nitro equals 153 rule. On Nclex, 1 tab, wait 5 minutes, repeat, max 3 tabs. Then call 911. Question 49. Which client is at greatest risk for bleeding when prescribed heparin? A. A client with a platelet count of 45,000. B. A client with hemoglobin 14G/DL. C. A client with potassium 3.9 milliequivalent/L. D. A client with WBC 6000. Correct answer, A. A client with a platelet count of 45,000. Rationale. Normal platelet count equals 150,000 to 400,000. 45,000 equals very low risk of bleeding and heparin-induced thrombocytopenia, HIT. Normal hemoglobin, potassium, and WBC are not concerning. Strategy. Heparin equals hold of platelets low. On Nclex, always check platelet count before giving heparin. Question 50. Which instruction is most important for a client taking levothyroxine, Synthroid? A. Take this medication with meals. B. Stop the drug if you feel nervous or have palpitations. C. Take this drug in the morning on an empty stomach. D. Double the dose if you miss one. Correct answer, C. Take this drug in the morning on an empty stomach. Rationale. Levothyroxine must be taken in the morning, on an empty stomach, with water only. Food decreases absorption. Nervousness and palpitations equals dose too high, notify provider, not stop suddenly. Never double dose if missed. Strategy. Levo equals leave food aside. On Nclex, think, morning, empty stomach, lifelong therapy. And that's a wrap on Nclex Pharmacology 101, Medications Simplified. Pill. Remember, passing the Nclex isn't about memorizing every single drug, it's about understanding the categories, the key side effects, and the safety tricks that the exam loves to test. If this breakdown helped you, don't forget to like, share, and subscribe so you never miss another Nclex prep video. Comment below what the medication category you struggle with most, and I'll make a video simplifying it for you. Stay focused, keep practicing, and always remember, you've got this.